Do your hands ever tingle or feel numb? You're not alone. Millions suffer from a condition called carpal tunnel syndrome. It affects people of all ages, from teenagers glued to their phones to office workers typing away at their desks. Carpal tunnel syndrome is a painful condition that can seriously impact your daily life. But the good news is, with some knowledge and simple changes, you can prevent and even reverse its effects. Imagine this: you struggle to grip your morning coffee. Typing an email becomes a painful chore. Even simple tasks like buttoning your shirt feel impossible. This is the reality for many living with carpal tunnel syndrome. The pain, numbness, and weakness can disrupt your work, hobbies, and even your sleep. It can affect your productivity and leave you feeling frustrated and helpless. But understanding this condition is the first step towards reclaiming your life. So what exactly is carpal tunnel syndrome? It's a condition that affects many people, causing discomfort and pain in the wrist and hand. But what causes it, and how can it be managed or prevented? Picture a narrow passageway in your wrist called the carpal tunnel. This tunnel is formed by bones and ligaments, creating a small space through which important structures pass. This tunnel protects a vital nerve that controls feeling and movement in your hand and fingers. This nerve is known as the median nerve, and it plays a crucial role in the functionality of your hand. When this nerve gets compressed or squeezed, it leads to carpal tunnel syndrome. This compression can cause symptoms like tingling, numbness, and even weakness in the hand. The main culprit: repetitive hand movements. Activities that involve the same hand and wrist motions over and over can put a strain on the carpal tunnel. Think typing, using a mouse, or even playing certain musical instruments. These activities can lead to inflammation and swelling, which in turn compress the median nerve. Poor posture and awkward wrist positions can also contribute to the problem. When your wrist is not in a neutral position, it can increase the pressure within the carpal tunnel. Taking regular breaks and stretching your hands and wrists can help alleviate some of the strain. It's important to give your hands a rest to prevent the onset of symptoms. Using wrist splints and ergonomic tools can also be beneficial. These tools are designed to keep your wrist in a neutral position, reducing the pressure on the median nerve. Physical therapy exercises can strengthen the muscles around the wrist and improve flexibility. This can help in managing the symptoms and preventing further damage. If symptoms persist, it's important to consult a healthcare professional. They can provide a proper diagnosis and recommend treatment options, which may include medication, therapy, or even surgery in severe cases. Understanding carpal tunnel syndrome and taking proactive steps can make a significant difference. By being mindful of your hand and wrist movements, you can reduce the risk and maintain healthy, pain-free hands. Carpal tunnel syndrome doesn't appear overnight. It starts subtly with occasional tingling or numbness in your fingers, especially your thumb, index, and middle fingers. You might notice these symptoms at night or after prolonged activities. As the condition progresses, the tingling can turn into pain that radiates up your arm. You might experience weakness in your hand, making it difficult to grip objects or make a fist. Recognizing these early signs is crucial for effective treatment. Section 5. Early detection, your best defense against carpal tunnel. Carpal tunnel syndrome is a condition that affects millions of people worldwide, causing pain, numbness, and tingling in the hand and arm. It occurs when the median nerve, which runs from your forearm into the palm of your hand, becomes pressed or squeezed at the wrist. This can lead to significant discomfort and can impact your daily activities and quality of life. Early detection is key to managing carpal tunnel syndrome. Recognizing the symptoms early can make a significant difference in the outcome. Symptoms often start gradually with frequent burning, tingling, or itching, numbness in the palm of the hand and the fingers, especially the thumb and the index and middle fingers. Some people with carpal tunnel syndrome say their fingers feel useless and swollen even though little or no swelling is apparent. If you experience any of the symptoms, don't ignore them. Early symptoms can often be relieved with simple measures like taking more frequent breaks to rest your hands, avoiding activities that worsen symptoms, and applying cold packs to reduce swelling. However, if the condition is left untreated, it can lead to permanent nerve damage and muscle atrophy. Consult a doctor or a qualified healthcare professional. They can provide a proper diagnosis and recommend appropriate treatment options. Treatment may include wrist-splinting medications and in some cases surgery. A healthcare professional can also guide you on how to modify your activities and work environment to reduce stress on your hands and wrists. They can diagnose the condition through a physical examination and possibly nerve conduction studies. These tests measure the electrical activity of your muscles and nerves to determine if there is any damage to the median nerve. Early diagnosis and treatment are crucial to prevent the progression of the condition. Early diagnosis allows for timely intervention, preventing further nerve damage and potential complications. Treatment options vary depending on the severity of the condition. For mild cases, non-surgical treatments such as wrist splints and anti-inflammatory medications may be effective. In more severe cases, surgical intervention may be necessary to relieve pressure on the median nerve. Remember, ignoring the problem will only worsen it in the long run. Taking proactive steps to address the symptoms early can help you avoid more serious complications and maintain your hand function. Don't wait until the pain becomes unbearable. Seek medical advice at the first sign of symptoms and take control of your health. Section 6 prevention is key simple steps for a healthier wrist. The good news is that carpal tunnel syndrome is often preventable. Simple lifestyle modifications can make a world of difference. Maintain a neutral wrist position when working at your computer. Use ergonomic accessories like keyboard wrist rests and vertical mice. Take frequent breaks to stretch your hands and wrists. These simple habits can prevent strain and keep your carpal tunnel happy. Section 7. Triumph over trouble. Real stories of carpal tunnel recovery. In this chapter, we delve into the inspiring journeys of individuals who have faced the challenges of carpal tunnel syndrome head-on and emerged victorious. Their stories are a testament to the power of resilience, determination, and the right strategies. Many people have successfully overcome carpal tunnel syndrome through lifestyle changes and proper management. These changes often include ergonomic adjustments, regular breaks, and specific exercises designed to alleviate the strain on the wrists and hands. Take Sarah, a graphic designer who suffered from debilitating wrist pain. Her work required long hours at the computer, which exacerbated her symptoms. The pain was so intense that she feared she might have to give up her career. By incorporating ergonomic adjustments, regular breaks, and hand exercises into her routine, Sarah found a way to manage her symptoms. She adjusted her chair and desk height, used a special keyboard and mouse, and made sure to take short breaks every hour to stretch and relax her hands. She also learned specific hand exercises that helped to strengthen her wrists and reduce inflammation. With these changes, she was able to manage her symptoms and return to her passion pain-free. Sarah's story is a powerful reminder that with the right approach, it's possible to overcome even the most challenging health issues. John, a musician, found relief by adjusting his instrument strap and practicing hand stretches. As a guitarist, his livelihood depended on his ability to play without pain. The repetitive motions and strain on his wrists had led to severe carpal tunnel symptoms. By making small but significant changes, such as adjusting the height and angle of his guitar strap and incorporating regular hand stretches into his practice routine, John was able to alleviate his symptoms. This allowed him to continue playing his beloved guitar comfortably. His story highlights the importance of listening to your body and making necessary adjustments to maintain your health and continue doing what you love. These stories are just a few examples of how individuals have successfully managed and overcome carpal tunnel syndrome. Whether you're a graphic designer, musician, or office worker, the key to recovery lies in understanding your body's needs and making the necessary changes to support your health. Ergonomic equipment, regular breaks, and targeted exercises can make a significant difference in managing symptoms and improving quality of life. Sharing these stories not only provides hope and inspiration, but also fosters a sense of community among those affected by carpal tunnel syndrome. Knowing that others have faced similar challenges and found effective solutions can be incredibly empowering. It reminds us that we are not alone in our struggles and that with the right support and strategies, recovery is possible. Consulting with healthcare professionals can also play a crucial role in managing carpal tunnel syndrome. They can provide personalized advice and treatment plans tailored to your specific needs. Whether it's through physical therapy, ergonomic assessments, or medical interventions, professional guidance can help you navigate your recovery journey more effectively. Ultimately, the goal is to regain control over your life and return to the activities you love, pain-free. The stories of Sarah, John, and many others serve as a beacon of hope, showing that with perseverance and the right approach, it's possible to overcome carpal tunnel syndrome and lead a fulfilling, active life. Section 8. Your health, your hands taking charge of carpal tunnel. Carpal tunnel syndrome is a common condition, but it doesn't have to control your life. By understanding its causes, recognizing the symptoms, and taking preventive measures, you can protect your wrist health. Remember, early detection is crucial for effective management. Don't hesitate to seek professional help if you experience persistent pain or discomfort. Section 9. Join the conversation, share your story, stay informed. Have you or someone you know experienced carpal tunnel syndrome? Share your experiences, tips, and questions in the comments below. Let's create a supportive community and learn from each other. And don't forget to follow for more informative health updates and tips for a healthier, happier you.